Good morning. It is July 22nd, 2025. I am Deanna Diamore, Director of Health for the City of Norwalk. I'm calling the July 2025 Board of Health meeting to order at 8:01 a.m. Present, we have board members Frank Ehrlich, Norman Weinberger, Joan McNeil, and Anthony Santella. We also have staff members Brian Weeks and myself present. The first item on the agenda is acceptance. Oh, the next item on the agenda is acceptance of minutes of June 2025. Do I have a motion?
Move.
Any comments or discussion on the minutes? All right. Just so you all know, I had a conversation with Anthony about making some corrections to the titles in the minutes. So I'll make those corrections, and moving forward, I'll make sure that the minute taker uses appropriate titles. So given that, all those in favor, say aye.
Aye.
Any abstentions? Any nays? All right, minutes passed. Thank you all. Next item on the agenda is public participation. I don't see anybody in attendees, so I will close that. And then next after that is the epidemiology update. So I'm going to pass it on to Brian. Good morning, Brian.
Good morning, Deanna. Good morning, everybody. Just kind of the normal update as usual. Should be fairly quick. So let me just switch over my screen so we can get this started. All right. All right. So again, we always start off with the respiratory virus situation. So we're looking at the community snapshot from the CDC for the state of Connecticut. Overall respiratory illness activity is very low, which is great to see. Emergency department visits low for the big three, so COVID-19, flu, and RSV. Again, just keeping an eye on the wastewater viral activity in the state. COVID-19 is at low versus flu and RSV, which are at very low. So again, really the thing to keep an eye on at the moment for the big three is COVID-19 with that activity. And then we'll switch over to the NRE VSS dashboard, just keeping an eye on those other circulating viruses that the CDC monitors for. Generally speaking, again, 'tis the season in the sense that, everything's kind of decreasing or downtrending, at certain levels. So as you can see here for like the rhinovirus and enterovirus situation, it's peaked a little bit earlier in the season. As well as even parainfluenza or human metapneumovirus, they are all downtrending as well, which is great to see. The exception to the rule at the moment is the red here, which is SARS-CoV-2 or COVID-19. So that is just slowly uptrending. It's not a steep curve. It's just a slight curve upwards. But it's something, again, just as I was emphasizing, that we just need to keep an eye on. And so now switching gears a little bit, just a reminder about measles. Unfortunately, we are making a lot of kind of milestones relative to the virus. And so we're on the right-hand side here. I just pull up the bar chart on the annual case numbers. So for 2025 so far, nationally speaking, we're at 1,309 cases, which has now exceeded even 2019, which was some of the highest in more recent years. And so in the broad spectrum of where we're at, it wasn't since 1992 when we had 2,126 cases has the national numbers for measles been higher. And so, again, this is just a kind of stark reminder just how unfortunate this circumstance is, given, uptake of the vaccine, just the potential for exposure to others, and then obviously manifesting the virus. So, this is still, only a little bit over half of the year now, and we're at 1,309 cases. So the hope is we don't outcompete 1992 in terms of those numbers, but again, the trend is not great. That we're still experiencing cases even now. So again, it's just a reminder, whoever we can engage in terms of friends, family, clients, just to make sure that they're aware. It's just a 2-dose vaccine, and I'll switch over to the health department's measles page. Again, they can be referred to this resource, norwalkt.gov/1822/measles. Just a reminder about the vaccine, just how effective it is. Again, it's 97-98% effective at the 2 doses. I mean, that's phenomenal. And so it really just helps mitigate, especially any sequelae or any other long-term effects, or even worse. for anybody that exposed, children and adults alike, as we all know, but I just want to reemphasize that because again, we're making milestones, but not good milestones, unfortunately, from national perspective. And so then along with that, I'm going to switch gears one more time, talking about infectious disease. So vector-borne disease, just a reminder about mosquitoes and West Nile virus. So this is the Ag Stations map for the current situation in the state. And the yellow here, so you have Stanford, Bridgeport, and Easton that have West Nile virus positive mosquitoes. So no human cases yet in terms of the surveillance right now from the state, but decent number, especially for Bridgeport, 6 mosquitoes that have tested positive for West Nile virus. So in the scheme of things, Lower Fairfield County is kind of the hotbed of West Nile virus activity for the state right now. Usually, sometimes you would get Hartford or somewhere in that mix, but not now. And so that means also in Norwalk, we're at higher risk given just, kind of being surrounded by this. So it's a very stark and, again, important reminder that everybody take their prevention measures. So I'm just pulling up the mosquito and West Nile virus page from the health department. What people can do to kind of protect themselves. I think definitely number one is, the mosquito repellent, especially an EPA registered one. So that's going to have like, what you would call it, DEET in it, as well as even lemon eucalyptus oil is also actually EPA registered, and so I use that all the time. And so yeah, it's just really important everybody take those precautions. Covering their bare skin, just with the long sleeves and long pants, and that also helps with ticks too, right? Tick detection too. And just along with that, draining any sort of stagnant water that can kind of then help mosquitoes reproduce and expand their territory. All those kind of great things. And there's also videos that the health department has put together in English and in Spanish that can help with that. So just hitting all those points home. Um, I think that's important too. And then tying that to weather now, just given, again, 'tis the season. Switching over to the City of Norwalk Extreme Heat and Drought Monitor Hub webpage, just a quick reminder what the weather is. So currently, using the Bridgeport site, that's how they currently do it in the National Weather Service as a representation for the Norwalk weather area. It's at 68 degrees Fahrenheit right now. Generally, just a hazardous weather outlook right now, just for most of the state and Norwalk and New York. But looking at more so from the human health side of it, from the CDC, the heat risk detector for Fairfield County, we're currently at minor, but I just wanted to hit home that Friday actually does enter major, along with Thursday and Saturday saddling that at moderate. But it's anticipated or forecasted to be about 96 degrees Fahrenheit on Friday. So just a reminder, as the weather kind of jumps around right now, it's a little bit cooler, which is nice, but it's going to go back up. So just want to emphasize that point. Then along with that, just kind of monitoring, or this is just kind of the recommendations relative to what people can do for extreme heat. So just some information for the general public, but then also just looking at the drought conditions. This is updated weekly. And so we're just seeing again, Lower Fairfield County is kind of where, some activity is relative to drought conditions, but it is abnormally dry. It's not at drought level yet. And so this is kind of more like the Greenwich and Stamford area, but they are kind of entering that territory a little bit. So it's just something else to kind of keep in mind because it is tied to, extreme heat, with drought conditions. And so overall, that's kind of just the update on my end. So just respiratory virus situation, overall mild, things are looking good. It's just, keeping an eye on SARS-CoV-2 or COVID-19, especially relative to the wastewater monitoring, but so far it's low. Then measles, unfortunately, we're making big milestones in terms of very large case numbers, nationally speaking, for this year so far. So just being mindful of that and just kind of getting that communication out to the public as much as we can. West Nile virus positive mosquitoes, a lot in Fairfield County, so it's just something to keep in mind and take those precautions, given that we're kind of caught in that mix too. And then also with extreme heat, just be mindful, especially of Friday, but then also Thursday and Saturday, saddling that. There is some, human health risk there too, related to that. So that's just a quick summary. Thanks, everybody, and good morning again.
Thank you so much, Brian. Just for the record, Janet Karpiak joined at 8:06 a.m. And I see, Frank, you have your hand up. Do you have a question or comment?
Yeah, I have two questions. One is for you, Deanna, the other is for Brian. The question for you has the national group of your peers whose meeting you just were at, have they taken a position in support of measles vaccines? And if not, should they, would they, could they? The question I have for Brian is, and maybe Anthony as well, has anybody ever looked into the West Nile virus and the mosquito-borne diseases and their relationship to areas with high number of swimming pools? Because one of the differences in Fairfield County is that Fairfield County has, I believe, more swimming pools per house, per home, than any other county in Connecticut. That's my two questions.
Brian, do you want to go first?
Sure.
Okay.
Thank you, Dr. Ehrlich, for your question. I mean, that's an interesting point. I would think with swimming pools, as long as they're properly maintained, that should mitigate any sort of mosquito ability to breed in the water, right? If it's chlorinated correctly, maintained correctly. It's a matter of people kind of neglect the pool, or the home is, abandoned or whatever it may be, that it can be a standing water source that then could contribute to mosquito spread. I mean, there's nothing in terms of an actual study that comes to mind at the moment in regards to that. Really, the success of these, the mosquito spread, and then also the West Nile virus situations, obviously the birds that these mosquitoes feed on. So it's Culex pipiens, that's the primary mosquito that's been detected with this. And so it's mostly mainly a bird feeder. And so it's just a lot of bird activity naturally that we have right now because of migration patterns. And then along with that, just a lot of standing water sources that help with the spread of the mosquitoes. As you recall, with the extreme heat webpage and the drought component, it happens to be Lower Fairfield County where the abnormally dry conditions are. So that's helpful in some ways to potentially reduce some of that, standing water. But regardless, we're just kind of unfortunate because it happens every year. Lower Fairfield County always gets impacted, but you sometimes usually have in parallel Hartford area. But again, it's really just more the standing water sources and everybody kind of doing their part to mitigate that. Again, keep in mind that Fairfield County also has the shoreline. So we're also going to have some impact from that too, in terms of standing water sources, even like, swamps and things of that nature too, that can kind of definitely contribute. And so I think that's kind of more those circumstances. But again, you're right in terms of if anybody neglects and does not maintain their pool, that can be a standing water source that further contributes.
And I'll jump in about the question about the measles vaccine and NACCHO. So NACCHO is the National Association of County and City Health Officials, and that is the meeting that I just was at their annual meeting. Frank, I don't know per se like about, a statement, but they have so many resources on their website where they promote the importance of measles MMR vaccination, talking about how it's, evidence-based and it's proven to prevent measles, mumps, rubella. They have so many different resources on their website talking about or just providing resources to local health departments on their own measles prevention work. And they do a lot to share lessons learned and tools and tips amongst local health departments, like providing the avenue for them to share like lessons learned and things that went really well for them. So their role, they provide an avenue for local health departments to share resources and tips, evidence-based strategies, and they promote the resources and the strategies and tools that are shown to work to prevent. And I can certainly share some more links too. And they do provide like webinars and other avenues as well for local health departments.
My concern is how much of the public, not other health agencies, how much of the public knows about the group whose meeting you were just at and the fact that they have this position and that they have these venues available, because if the public doesn't know it, that's who's making the decisions about getting vaccinated.
So I know this goes into where I want to have a discussion later on, our next. So that's a really good segue, Frank, to where I want to go next. Unless anybody else has any other questions for Brian or any other comments. Okay. Well, thank you, Frank, for that, because that's perfect. So one of the big themes so I'll take a step back. I just came back from the National Association of County and City Health Officials annual conference that was held last week in Anaheim, California. And the theme for this conference was Bright Lights, Bold Ideas, Shaping the Future of Public Health Practice. So what NACCHO is it represents the over 3,000 local health departments across the country. And they convene all the different leaders and practitioners from these health departments to give them the opportunity to learn, to network, to share experiences and best practices, and to provide a space to discuss challenges, innovative ideas, success stories, to engage with each other, and to gain insight from different, public health experts. There's different strategies, concepts, talking about evidence and best evidence-based practices. And it has sharing sessions, live plenaries, town halls, workshops, all different principles. Big focus. They have all different topic areas, right? They talk about workforce assessment and development, policy assessment, public health law, informatics and epidemiology, public health preparedness, infectious disease prevention, mental health and well-being, substance use prevention, recovery, emergency preparedness, response, etc., all the things. But they did have some themes and some focus areas this year. One was about the workforce in general and the health and safety of the workforce, and celebrating the workforce and figuring out where we are now and where we need to go. Another focus for one of the plenary sessions was mental health and well-being, community mental health and well-being. And then another topic was about focusing on, where are we, where are we now, in the context of public health? Where do we focus moving forward? How do we prioritize? And a big talk about that session was about communication and talking about the importance of public health and the role of public health in communities, and what specifically local health departments do to enhance the health of communities, and how we need to be doing more to make, public health visible. So, as to Frank's point, to talk about not only the role of local public health and these strategies, but the importance of all of prevention and these evidence-based tools and strategies that work, that focus not only from a health perspective, from an economic perspective as well, right? It saves money, and it really helps economic development of communities if you have a healthy community, and all the other social determinants of health, right? Like education and so on. And then another focus also was on AI and where we are with AI, and what do we need to learn living in this, in the world right now, and how do we learn about AI? How do we use it safely and ethically? And so back to your question, Frank. I've been thinking about, what do we as public health practitioners, right? Those of us who work in local health departments, what do we need to do to continue to communicate about these health issues and about public health, but then also about our board, right? What's the role of our Board of Health? How can, we be elevating the Board of Health? How can that Board of Health be elevating and advocating and talking, more and more about public health? So I guess I pose a question back to you all, Frank, because I think we all have a role in that, and we all have there are incredible minds on this board who have so much to offer. So I guess I'll throw it back to you all too to talk about that, because I think and certainly the National Association of County and City Health Officials has a role, and so do we all. So how can we be working together with that messaging? So I'll pass it on to you all. Anthony?
I think part of it is when most people think of a health department, they think of food safety. I don't think most people are thinking about vaccinations, community engagement, epidemiology, surveillance, et cetera, et cetera. And probably that's what they see or they hear about when things go wrong. They don't hear about, the invisible successes because things are being prevented. So I don't necessarily have a specific idea right this moment, but I think part of elevating the work of the health department is to maybe think about how to inform the public about the depth and breadth of the work that the department does, whether that's through social media or capitalizing on, you know, places where people congregate or other city agencies, right? We think about social determinants of health. So we think about like education and economic planning, financial development, whatever, the other human services, et cetera. So, like I said, I think part of it is correcting myths, misinformation about what health departments do, capitalizing on the other city agencies, and finding existing venues to share information without adding additional burden to the health department staff, right? There probably already are community newsletters and, social media platforms that get a lot of visibility and things like that. Those are my initial thoughts.
Thank you so much. Joan?
I'm muted. So the work that is done by the health department, I think is well documented, and I think it's visible enough on the website. I think the areas where we're possible falling short is in the area of education and communication. So how do we get this word out there? I think we could start with probably a town hall, which could go either way. I mean, because sometimes you get questions thrown at you that are that is not applicable at the moment. So we could start with a town hall, or we could figure out where are the biggest places where the residents of Norwalk communicate, and try to get our word out at that venue. So I think a big thing is education, and how do we communicate the work that is being done.
Thank you, Joan. I think Frank is next.
I just quickly, I think Anthony has perhaps hit the nail directly on its head, in that if we look back at vaccination, the public, I don't believe, had any thoughts or any cares until COVID came. That those of us responsible for public health in some manner, way, or shape need to be upfront and first, not in the world. What happened with COVID was the negatives got first say. And once they get first say, we're reactionary. We need to be primary, upfront, and propagating all the good things that public health is responsible for, takes care of, and does. We don't do that, and we haven't done that. We're reaction, not.
Thank you, Frank. Some of it I missed because I think the connection was off, but I just want to make sure I got all of it. You're talking about being more rather than being reactionary, being more visible and upfront about all the great things that public health does, and including vaccination, is rather than being reactionary.
Yes, we need to make the public totally aware on a daily basis, not on a epidemic basis.
Thank you. Janet?
Yeah, this kind of is almost like a flashback because we've had this discussion before and we were actually starting an initiative to get ourselves a little more publicly aware of all the things that as a health department we're doing. And then COVID hit and it sort of everything took a sideline. And I agree, we've been forced to get into a reactionary type of component. But at this point, I think moving back to that where there were health fairs that we attended. There were a number, anytime there was a school function or there was a health center a booth that would help promote some of what we promote. And, and made people much more aware. And it was actually having a very positive effect. Unfortunately, we're 5 years down the line and, that sort of is an important point to revisit. And this is where things like vaccine promotion, our incredible vaccine record in the area, which is really the result of some phenomenal people in the health department, needs to be put out there and, and encouraged and, just overall making people much more aware of all the facets of the health department.
Thanks, Janet. I think Norman and then Frank.
I absolutely agree with what Janet has said. I think we're in a funny place post-COVID where science and facts are subjugated by falsehoods and social media. And I think it's very important to get out in front of this. And I think Joan's idea of town hall meetings, and even though they may be uncomfortable, is to come up with facts to people and yet to be as present as possible. Go into the schools and present things to the faculty, present things to the kids. I think the more visible the organization is, the better.
Thank you, Norman. Frank?
Yeah, just a quick comment. I don't think that this is just our responsibility. I think it's the responsibility of everyone involved, and that includes every physician who sees a patient. I think the medical community, as an example, in my own family, I have 2 grandchildren. They're small. They go to pediatricians for vaccinations. And when I asked my daughter and son-in-law, why did they get the vaccinations? The standard answer is to prevent getting the disease. They don't know anything more than that about a vaccine. And that's the responsibility of the physician who gave the vaccination. So I think we need to communicate this responsibility to a much broader base than just this committee here.
Thanks, Frank. Norman, did you have your hand up?
Well, just quickly, certainly the American Academy of Pediatrics has been very vocal in putting out information that the pediatricians in the front lines can put out. Whether they do that or not is, but the organization has been very strong in putting out information that can be used.
Thanks, Norman. So I see there's a lot of great ideas. I'm taking notes, and who knows, this is recorded so I can go back and make sure I don't miss anything. But there are a lot of really great ideas. Is there an interest to, if we do continue to do more communication, participating in some of, I know we've already been participating in different press events and other events, but would you be interested in, if we do some of these town halls or convenings or more presentations, joining more, meetings where other people are participating in that as board members?
Yeah.
Yes, absolutely.
Mhm.
That's great. Thank you. And then also, potential outreach to other community partners with some of this messaging as well, kind of alluding to what Frank is saying too. All right. Any other thoughts? All right, so as I hear of opportunities too, that exist beyond, what we plan, I'll keep you all in the loop, to see if there's any interest, whether that's like educating, or advocating with legislators, that sort of thing as well. Because, there are certain things that, I have my eye on too, related to funding. One of the areas that we're paying close attention to is our public health preparedness funding. Right now, that is not recommended in the president's budget. There's also, it's not recommended, the Preventative Disease and Health Block Grant that we've received. We receive about $54,000 a year for that block grant, and we receive about $50,000 for the public health preparedness grant. And so, as you all know, we have 2 part-time preparedness staff. And so they're looking at potential cuts there at the federal level, as well as some of the money that's used to support our programming, some of the supplies and that sort of thing. And so really trying to make that connection between, that those for federal dollars, but they trickle down to the local level and they're used to do really great work out in the community, to protect health and promote health for community members. So want to speak more to that and just the importance of preparedness, right? And having the infrastructure in place. Like, I can't even imagine where we would have been with our COVID response if we did not have our volunteers to help us and support us. And that infrastructure is supported by our preparedness staff. It's just one example of the many of why we need this funding, in public health. And I know I'm kind of jumping around. I think I skipped my director's report, but that was part of it, was talking about that funding. The Immunization Action Plan contract remains, we're working on that to get that executed with the state. They did get the funding from the federal government, as Janet talked about the amazing vaccination rates that we see in this community. And so we, of course, want to see that work continue. And so we're working on being able to continue to offer that in Norwalk. And we some good news in the environmental side. We filled a health inspector role. We have a current part-time staff member who's going to be transitioning into a new role for a full-time health inspector. So we're really excited to fill that role, and she's up and doing various trainings, so she's up to date with everything. And then the last thing I'll share is that we're bringing some trainers to do some quality improvement training for our staff. We have several, newer staff members who haven't gotten the formal training. And so we have our QI work group who's also really interested in getting that training. So those are the big highlights. Any questions or any other further discussion? All right. Hearing none, we can adjourn at 8:35. Thank you, everyone. I really appreciate the great discussion today, all the great suggestions.
Thank you.
Thank you.
Thank you.
Thank you.